Hello everyone, welcome to our channel Simple Nursing Notes. ଏହି ଭିଡ଼ିଓଟିରେ ଆମେ OBGର ଆଉ କିଛି ଇମ୍ପୋର୍ଟାଣ୍ଟ କ୍ୱେଶ୍ଚନ୍ ଆନ୍ସର ଅଛି ସେଗୁଡ଼ିକ ଡିସ୍କସ୍ କରିନେବା କାରଣ ମୁଁ ଚାହୁଁନି ଯେ ଏସବୁ ଛାଡ଼ିବା ପାଇଁ କୋଉଠି ଆପଣମାନଙ୍କ କାମରେ ଆସିପାରେ ଏସବୁ ଆଉ ଯେଉଁଗୁଡ଼ିକ କି ଇମ୍ପୋର୍ଟାଣ୍ଟ ସେଇଟା ପଢ଼ିନେବା ଦେନ୍ ଆମେ ସାଇକୋଲୋଜି ଷ୍ଟାର୍ଟ କରିନେବା। ନମ୍ବର 36, a 26-year-old female primary gravida presents to the clinic to discuss her estimated date of birth. The nurse records the client's first day of her last menstrual period as February 28, 2015. What would be her EDB? December 6, 2015, December 7, 2015, December 5, 2015, November 28, 2015, November 5, 2015. The answer is C. December 5, 2015. Estimated date of birth বা expected date of delivery केमती बाहरे तार explanation इठी दिया जायछि। ଏହି एक्सप्लेनटी नेगिल्स रूल का हिसाब रे करा जायछि। आ गोटे रूल मध्ये अछि जेउथिरे कि 280 डेज ऐड करा जाय। नंबर 37 एंड 38 रो क्वेश्चन बहुत लार्ज अछि सेति पई ए दिटिया क्वेश्चन रो आंसर मो वीडियो रो लास्ट रे दे देउछि जो माने इंटरेस्टेड जाय कि पढि नेबो। Question number 39. Which type of aberration is associated with sepsis, cramping, abdominal tenderness and an open cervical os? Threatened aberration, spontaneous abortion, inevitable aberration, complete aberration, missed aberration. The answer is E. Missed aberration. This is explanation. Number 40. Which of the following statement is true about a hydatidiform molar pregnancy? मैं ऑप्शन गुडी को बहुत बड़ा अछि सेति पे पढुनी म आपण मान को केवल देखि दोछि। These are the options. The answer is A. Hydatidiform molar pregnancy कण अति सुंदर भाबरे ता एक्सप्लेन करा जायछि। Number 41. A woman is hospitalized for preeclampsia. Which medication may the nurse administer to prevent the occurrence of seizures? Calcium gluconate, magnesium sulfate, zolpidem, Nuben, pitocin. The answer is B. Magnesium sulfate. इठारे सबु मेडिकेशन रो यूजेस एक्सप्लेन कराइछि। Number 42. Jeans is a 33-year-old woman who has previously had regular periods but has not gotten her period for 6 months. Which of the following would the nurse rule out at the cause? Options are cross-country running 5 times per week, poor eating habits, yoga once per week, kidney disease, antidepressant use. The answer is C. Yoga once per week. Number 43. Sandy is 29 years old and experiences bleeding between periods. The nurse marks which of the following on Sandy's medical chart? Oligomenorrhea, menorrhagia, menometrorrhea, metrorrhea, polymenorrhea. The answer is D. Metrorrhea. Number 44. A patient tells the nurse that she is practicing fertility awareness. The nurse tells the patient that the onset period can range from 7 days before and 7 days after ovulation, 2 days before and 2 days after ovulation, 1 day before and 1 day after ovulation, 2 days before and 1 day after ovulation, 1 day before and 2 days after ovulation. The answer is A. 7 days before and 7 days after ovulation. 7 days before and 7 days after ovulation ଏହି ପିରିୟଡ଼ଟିକୁ କାହିଁକି ଅନସେଫ୍ ପିରିୟଡ଼ କୁହାଯାଏ ତାର ଏକ୍ସପ୍ଲେନ୍ ଏଠି କରାଯାଇଛି। Number 45. Which of the following is false regarding oral contraceptives? They may increase the risk of developing a blood clot. They may decrease the severity of menstrual cramp. They may decrease the risk of breast cancer. They may heighten the risk of depression. They may reduce the risk of uterine cancer. The answer is C. They may decrease the risk of breast cancer. Oral contraceptive विषय रे ए स्टेटमेंट टी हेउची फॉल्स स्टेटमेंट काहेकि ना ओरल कंट्रासेप्टिव यूज करवा द्वारा ब्रेस्ट कैंसर रो रिस्क इंक्रीज होई थाए नॉट डिक्रीज होई थाए। तार एक्सप्लेन मध्य एठी दिया जाईछि। Number 46. A 51-year-old female arrives at her doctor's office because she has not had any periods for 12 months. The nurse should suspect pelvic inflammatory disease, endometriosis, menopause, polycystic ovarian syndrome, pregnancy. The answer is C. It is menopause. The explanation. What is amenorrhea? What is menopause? It is endometriosis मध्य एटी कोन देइछि। Number 47. Jody is a 40-year-old woman seeking care for dysmenorrhea for the first time, which would not be considered an appropriate treatment. Oxycodone, acetaminophen, naproxen, oral contraceptives, ibuprofen, lifestyle modification. The answer is A. Which would not be considered an appropriate treatment? It is oxycodone, acetaminophen. It is explanation. Finally, आमर ओबीजी रो MCQ तार आंसर गुड़िक फिनिश हैला। एबे आमे साइकोलॉजी रो MCQ तार आंसर गुड़िक पढ़िबा। Question number 1. Psychology has been classified as a science for approximately 300 years, 200 years, 100 years, 50 years. The answer is C. 100 years. Number 2. John Watson founded a movement in psychology known as structuralism, mutualism, behaviorism, introspectionism. The answer is C. Behaviorism. Number 3. The factors in perceptual organization most influenced by learning in common movement, continuity, proximity, perceptual constancy. The answer is D. Perceptual constancy. यहाँ को ऑब्जेक्ट कंस्टेंसी मध्य कहा जाए। यार माने कौन एनिमल बा ह्यूमन बींग्स एमानकर जो एबिलिटी थाए कौन सी जिनस को देखिबा सुनिबा बा कौन सी जिनस विषय रे ज्ञात हेबा तार जो एबिलिटी थाए ताको परसेप्चुअल कंस्टेंसी कहा जाए। Number 4. Psychology is not a science, perfect science, behavior, scientific method. Answer is C. Psychology is not a behavior. It is a science of behavior. Number 5. Psychology deals with to any kind of situation that life present stimulus, observation, attention, responses. The answer is D. Responses. Number 6. Case study helps us to know about individual, environment, personality, none of above. The answer is A. Case study helps us to know about individual. Number 7. Habitual attention developed during the course of our studies, environment, experience, stimulation. The answer is C. Experience. Number 8. Attention increases concentration, motivation, efficiency, interest. The answer is D. Interest. Number 9. Attention is a form of activity of the body, mind, organ, sensation. It's B. Mind. Number 10. Perception varies with motivation, concentration, attention, external organs. The answer is A. Perception varies with motivation. Number 11. Putting one's leg in other shoes is sympathy, concern, support, empathy. The answer is D. Empathy. एक कथा आपण मानक कही रखे कि मोर मेन मोटिव हेउची जो मानक पाखरे बुक नाही, जो माने नर्सिंग ऑफिसर एग्जाम देबा पई चाहूचंती सेमान को पाखरे सब क्वेश्चन आंसर पहुंचू. जदि भी कोनसी क्वेश्चन बा आंसर बुझी पारनांती तो कमेंट करके पचारि पारिबे. नंबर 12. Which is the most important method of psychology? Interview, case study, experimental, observation. The answer is C. Experimental. Number 13. Who among the following claimed that the heredity determines personality? Options are Mac Lever and Page, Abrahamson, Gayton, none of these. The answer is C. Gayton. Gayton कर पूरा नाम हेउची आर्थर गेटन. ए हेउचंती जणे अमेरिकन फिजियोलॉजिस्ट और से क्लेम्ड करथिले जे हेरिडिटी डिटरमाइन्स पर्सनालिटी. हेरिडिटी पर्सनालिटी को निर्धारित करिथाए. नंबर 14. वी कैन से पर्सनालिटी इज ऑफ ए नेचर psychophysical, psychological, physiobiological. The answer is C. Personality is of a nature psychological. Number 15. Perception is sensation plus memory, images, language, interpretation. The answer is A. Perception is sensation plus memory. Number 16. Recognition based on past experience is recall, remembering, perception, conditioning. The answer is A. Past experience को reorganization करिबा ही हेउची recall. Number 17. Illusions are wrong perception, size, consistency, shapes of objects, molecular cues. Answer is A. Illusion are wrong perception. Number 18. Ego defense mechanism is a reaction to motive, aggression, emotion, frustration. Answer is C. Emotion. Number 19. Personality is largely influenced by speech, social interaction, gesture, language. The answer is B. Social interaction. Number 20. Memory is related to our personal affairs and experiences, short-term, long-term, semantic, episodic. The answer is D. Episodic memory is related to our personal affairs and experiences. Number 21. The art of applying memory device is called eidetic, mnemonics, chain technique, photographic. The answer is B. Mnemonics. A mnemonic device ହେଉଛି ଗୋଟେ memory device ଯାହାକି help କରିଥାଏ ଆମକୁ increase ability to recall information. Information ଗୁଡ଼ିକ recall କରିବା ପାଇଁ ଆମର ଯେଉଁ ability ଥାଏ ତାହାକୁ increase କରିବାରେ ଏହି device ଟି help କରିଥାଏ. Number 22. A mentally retarded child has an IQ test of below 80, 70 or below 80 and above, below 100. The answer is B, 70 or below. नंबर 37 और नंबर 38 बहुत लार्ज अच्छी से मु पढ़ौनी केवल वीडियोर लास्ट रे मु एटा देदेली एथिपाई जे जदि किए इंटरेस्टेड थिबो एटा पढ़िबा पाई तो पढ़िबो। नंबर 38 भी बहुत लार्ज अच्छे तार ऑप्शन गुड़िक बहुत लार्ज अच्छे से मु पढ़ुनी अजथा टाइम वेस्ट हम मु केवल वीडियोर लास्ट रे दे दूची यहाँ जदि किए इंटरेस्टेड पढ़ाई तो पढ़ी निब आ जो मैंने पढ़ा को चाहूना स्किप कर पारिबो। These are the options. This is answer and this is explanation.